Okay, so it looks like we're tachycardic. Our O2 sat is 91.
All right, we got your ID band.
What did you say the weight was? 3 pounds what?
3 pounds, 12 ounces.
Yeah.
Listen to your heart, your lungs.
We do it all here at UC Davis Children's Hospital.
Right in your own community.
It's hard enough to be in an ICU. It's even harder to have to travel 100 miles every day to go see your child. And so a family in the Sacramento Valley going through something unimaginable and difficult, they have everything they need here.
UC Davis Children's Hospital is a nationally ranked academic children's hospital. We serve 65,000 square miles in California, and we serve 33 counties.
They've used an EpiPen in the past that's resolved his symptoms.
Okay, so he presented just like this before?
Correct. Right.
We're a level 1 pediatric and adult trauma center.
Okay, is our epi in? Epi's in. Epi's in, great. So let's give that methylprednisolone. It's 2 mg per kg.
Having a separate emergency department for pediatric patients is really a healing environment. It really helps us focus on kids, and it helps the families know that kids are really important to us.
I'll get that stuff ready for you, and then the nurses will give him that medicine.
Thank you so much.
Okay, yeah, thank you. All right. Thanks, Preston.
Do you know what animal that is right there?
That's a dolphin.
When you come in the ER, it's like emergency room, but here it looks more, kid friendly and stuff, and I like that more for him and for my own sanity.
That just goes in your mouth. You ready? I'll check back in just a little bit and make sure he does okay with the medicine.
Thank you. There's enough people able to help with concerned parents, so they're calming you down, and then somebody still to tend to your kid and calm them down. I love UC Davis.
I think the main thing that drew me to UC Davis, and specifically the Children's Hospital, was the opportunity to create new programs and to really come to a place that is growing. We have all the services here, and I think a lot of it has to do with just having the right vision and the right leadership to put it together, and then to be able to do some really spectacular things for kids here.
All done.
Fetal surgery is our ability to identify problems in unborn babies, and then the ability to operate on that baby before they're born. The UC Davis Medical Center is one of only 2 centers on the West Coast that's able to do open fetal surgery.
Is he on any medications at all?
The NICU allows us, in our partnership with our neonatologists, to take care of the most severely affected children.
You still sleeping, bud?
In a lot of ways, the NICU is the linchpin for our ability to be able to care for our smallest patients.
All right, Miss Alina, hi.
Pediatric ICU is a place where children in Sacramento and surrounding areas who require a higher level of monitoring are brought for intensive care. Because our ratios are 2 patients per nurse or 1 patient per nurse, I'm able to give a lot more direct care, a lot more hands-on. I feel like this is a place where we can really just be nurses. You can't separate an individual from the context of who they are in their family. You can't heal a child outside of their family.
Whenever you get care in a research center, you are able to get care that you know is the most up-to-date. We now provide it right here at Davis because of the interplay of our research efforts and our clinical efforts.
Hello, green eggs and ham? I would not eat green eggs and ham. I do not like them, Sam I am.
Child Life uses play in order to help kids get through procedures, get through hospitalizations. It really gives the child control of the environment. It makes a huge difference in care. The more you can normalize that environment and make it fun and include play in everything, it just makes the whole hospital stay much better.
Hey, bud! I'm sad.
You're sad? Yeah, why are you sad?
Getting down to a child's level, hugging a child, hugging a mother, asking the child what they do at home. Oh, so life's all about unicorns, huh? Then we can really customize and build our relationship with them on that and hopefully help their hospitalization.
We'll see you another time.
Take care, little honey, okay? Give Lucy hugs. Okay.
Definitely.
Nice to see you.
It was good to see you too.
Taylor woke up one morning with a lot of pain, and we had been advised to go to the ER if she woke up that way. and that got a diagnosis with acute lymphoblastic leukemia. From there, we had a almost 2-week stay in the hospital. We were introduced to Child Life and some amazing nurses and doctors who very quickly became our family.
You know how it goes. We have to make sure that it's actually in there.
The nurses and the doctors, they know Taylor's likes and dislikes. They really get involved in our lives.
Should some more to the yellow?
Going through it, you don't see the end goal. You don't see the light at the end of the tunnel. And the nurses there, that's their goal, is to get you there. Thank you much.
Oh, it was so good to see you and always good to smell you.
Knowing that we were going to UC Davis Children's Hospital to see the doctors that we love, the nurses that we love, it was never a burden.
Hello!
What we're trying to create here is a center of excellence for the care of children. We can't do it only on the backs of the goodwill and the hard work of the people here.
Show me how strong you are.
Sweat equity only goes so far, and that what we do need is support in terms of resources for more space and more equipment and more technology to be able to provide the level of care that we can here.
Can you wave? Bye-bye.
Donors make a huge difference, and there's no question that without them, even the greatest of hospitals wouldn't be as great as they are. It's very clear that donors are critical to the lifeblood and growth of hospitals.
The beads are through Child Life at UC Davis. The nurses made the banner.
I had barely even any hair when I got her.
She does want to do something Child Life related or a doctor related. She will. She'll move mountains.
She was always there for me.
We don't save lives, we save lifetimes. We have the ability and opportunity to impact that person for the rest of their life.